From our 22 News Broadcast Center, this is 22 News in Focus.
Good Sunday afternoon and welcome to 22 News in Focus. I'm Laura Hutchinson. In January, Massachusetts welcomed a new administration to the State House. Governor Charlie Baker and Lieutenant Governor Karyn Polito were immediately faced with the dilemmas surrounding weeks of snowstorms that left part of the state immobilized, including Boston. And now they're working on everything from the budget to programs designed to reduce gang violence and homelessness, improve employment and education, and address the addiction crisis here. And that's where 22 News in Focus comes in today. We'll talk about some of the big issues facing our state right now. Then later on in the program, we'll talk to a member of the governor's opioid working group who's from Western Massachusetts about the announcement made last week to curb opioid addiction. But first, we have for the first time on our program today, Lieutenant Governor Karyn Polito with us. Thank you so much for being here.
I'm so happy to be with you this morning. Thank you for having me, Laura.
Yeah, so talk to me about how things are going. You've been in for a few months now. There's been a number of challenges that you've already had to face. So talk to me about how this is going for you.
It's actually a really good time to sort of take a pause this morning and say, wow, where have we been, and where are we, and what will the next 6 months look like? And I think one of the things that I learned from looking at this time period is, like, every day is different. You just will have what you want to accomplish and our plans, and implementing our goal of making Massachusetts great everywhere, and then all these things distract you from that as well. So you have to balance both. And certainly when we came into office in early January, made our inaugural tour, came through the Springfield area in Western Mass, and it was great, and we were ready. Let's balance the budgets and let's get going with our team and our new cabinet. And then it snowed, and it snowed, and it snowed, and it snowed. And what the snow did was allow us to really, as a team, come together and really just be very strategic every single day. And so that's what we do. We love what we do. I really value public service and good leadership. And I ran with Governor Baker because both of us have government experience. Both of us had local government experience as selectmen. Both of us have different business experience. I come from a family, construction and real estate, small business perspective, and we both felt that there were areas of the state that just needed more attention, more opportunities for people to just do a little bit better. And as a mom with 2 young children, I want them to have the choice of being able to grow their family someday, plant their roots as the next generation, and have every opportunity that they want in their lives available here in the Commonwealth. So I'm motivated on a personal level, and then just on a public service level, and valuing the opportunity to work with Governor Baker and the people that we've assembled as part of our team to just really roll up our sleeves and work hard.
What would you say is one of the top issues that you're excited to get involved in, and you walked in, you were just ready to do it right away? What would you say is one of your top issues, and do you sort of see yourself able to do that now?
Well, I was really happy that Governor Baker made his very first executive order the one around our communities. Because I had such a great upbringing in my hometown of Shrewsbury, which is right in central Massachusetts. I had a safe neighborhood growing up, had a great neighborhood school to attend, and opportunity, jobs, and I have the opportunity now through the compact, through the Commonwealth's compact, to be able to reach all of the communities across the Commonwealth. And the governor will remind me every day, you have 351 cities and towns to reach. And that's what I love about Massachusetts, is that every region is different. Every region has a different challenge or opportunity, and like a vibe. So as I travel around the state, I can really tap into that by being present, learning from the community and business leaders. What do you want? What is your vision for your community? And how can we, as a state government, partner with you, provide you with the resources you need and help you achieve your goals? So for me, just that basic, focus is really important, because that's what people feel their quality of life. That's how the next generation will decide, are they going to stay here in Massachusetts, or are there better opportunities elsewhere? And I feel at this stage in my life, working as, alongside of Charlie Baker, our experiences are right for the time, and that just work hard really at it every day to get there.
I'm glad that you mentioned the Community Compact Cabinet, because you were actually in Agawam this week for that. So talk to me about what communities need to establish. How does this actually work? And, what deadlines do they have to meet in order to make this happen? I guess, how does that program really work?
Well, first of all, on the campaign trail, the governor and I heard a lot from communities that said, we're a good community, and it seems like it takes a community to fail and make poor decisions, and the state bails them out after the fact. And he said, that's not fair to the communities that are really trying to do the right thing every day. So this is an incentive-based program that is voluntary for a community to participate in, and it's up to the community to decide, where do we want to go? What is that best practice that we want to achieve, but we just don't have enough resources locally to do that. So that's where the state can come into play. Our secretaries, our agencies, our cabinet is available to the communities to help them achieve that next level of service in their community. It could be an IT project to make government more accessible to their citizens. People work every day. They want to be able to pay their bills online. They can't always get to city or town hall to do their work. So making government more efficient and responsive that way is an example of how this compact can help. Plus, we have statewide grants for infrastructure, for parks, for complete streets on main streets. In a community that signs the compact with me as the point person for this is able to place their community in a more competitive position for the statewide grants. So that way we're incentivizing better decision making on a local level, and we're rewarding the good decision making. So it's an incentive, carrot-based approach to help communities just raise the bar, bring their A game to the table. And on the flip side, the state has to be a better partner. That's why the governor and I, right out of the gate in January, funded Chapter 90 for road resurfacing and sidewalk repairs. We've increased aid to our cities and towns for local services and schools. So we're putting our money where our mouth is too, and providing the resources to the communities to do their job. That's where people feel their quality of life. That's how families decide where to lay their roots and raise their family. And we would just want that experience to be everywhere in the state. I bring the perspective from outside of Boston. I'm from central Massachusetts. So when I think of Western Mass, and the South Coast or the North Shore, I bring that perspective and I bring that voice for the communities that are not Boston, that need the attention and deserve to have that relationship with state government.
It sounds like that's a great opportunity to build a personal relationship with the administration as well, just to sort of get that conversation going.
Oh yeah, we have a lot of fun too.
Yeah.
But when you know the mayors and the managers and the selectmen, the people that are, at public meetings on a Tuesday night and, doing all the work that they do, literally being able to pick up the phone and call each other and share our ideas is important. Plus, there's a sense of urgency to the work that we do. Governor Baker and I are elected for a 4-year term, and already we're at a 6-month mark, and how fast this time has passed. So every day is urgent. Every meeting we have with a municipal official is important, and all of our decisions, whether it's budget related or policy related, we put through that lens of how can we make Massachusetts great everywhere, from a health perspective, from an economic perspective, and from an opportunity perspective for the next generation.
You were also here for the Union Station announcement that the final funding was secured. Transportation is a really big issue in this area. We have the I-91 viaduct reconstruction about to get going. We're watching this Union Station project. Do you see your administration wanting to put a rail from east to west, sort of connecting the state a little bit? We were just talking about the commute into and out of Boston sometimes. Do you see something like that happening?
Well, I feel it's true. Commuting to Boston is very hard. I'd much rather commute west.
Yeah.
And I think a lot of families feel a really good quality of life, outside of that, heavy populated area around the Boston area, and need opportunities to be able to get to work through reliable public transportation. People love public transportation. And so there's a study underway right now that Massachusetts is participating in with Vermont and Connecticut relative to transportation here in the greater Springfield area and the east-west train connection is also understudy. And I think that Springfield is well positioned, Springfield area, the Pioneer Valley, well positioned right now for economic growth. When you look at the density of population in that whole Pioneer Valley and that knowledge corridor, it's really growing. And of course the students that are involved in the 29 plus colleges and universities are the next potential for us. We want those graduates to stay here in the Pioneer Valley and to lay their roots and grow their lives. So I think that infrastructure improvements, that whole economic development plan is really important. But Springfield and the leadership here in the Pioneer Valley is really strong. They have a plan, they have a vision, and for us at the state level, when we see that level of collaboration and preparedness relative to a planning standpoint, we can invest our dollars, and we know that this community will leverage those dollars and really achieve the overall goal of economic development. So yes, the 91 has to be done. Repaired. Got MGM coming here, that's exciting. But beyond MGM, you have a lot of good things happening, from Springfield Tech to the healthcare industry to the advanced precision manufacturing industry. A lot of good things going on in this area, and we're happy to invest and happy to help. Yeah,
it's exciting to hear about all of these investments and research that's underway for this area, because it really is an amazing time for us here. We have a lot more to discuss. We are going to take a short break. Lieutenant Governor Karyn Polito here joining us. Thank you so much for being here. Again, we'll have much more to discuss with the Lieutenant Governor after this, including homeless families living in hotels and how that's being addressed. Stay with us. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about key issues facing the state. Later on in the program, we'll hear from a doctor working with the governor's administration to curb drug abuse and overdoses in our state. But first, let's continue our conversation now with Lieutenant Governor Karyn Polito. Thank you again for being here. One big issue that we've watched very closely over the past few years are the homeless families living in hotels. It's obviously costing the state a lot of money. It's not ideal for the people living in the hotels. What is the new plan? Under the last administration, we were sort of frustrated when the end date came and went. June of 2014 is when they wanted the families out, and we still have families in there a year later. So I'm just wondering, is there a new plan to help these families get into more secure housing and also save taxpayers a little bit of money?
Oh, absolutely. And this is an issue that's very important to Governor Baker, to me, to our team, and it's one that we heard an awful lot about on the campaign trail throughout our state. And we disagree with the policy of using hotels and motels as shelter space. We feel that there is a much more effective way and supportive way to helping, particularly young mothers for the most part, on a path to a better success. And our approach, which is different from using the hotel-motel system, is to support that person in the community where they have ties, where their children are already perhaps in school, and to take the services and take the dollars associated with helping them in that community. And it could be that they need child support. It could be that they have an addiction that needs to be supported and helped. It may be that they need access to skills and get on a path where they can achieve a certificate and then learn how to work and get on a job path. Instead, removing them miles away in a community where they have no ties, in a hotel room where they're not getting the services that they need to be well and to be strong and to build their self-esteem, isn't working. Plus, the host communities that have these hotels in them are having to deal with public health issues, public safety issues, school issues, paying for transportation for students to go back to the school district that they were coming from. So we know that this needs to change. In our budget, we have offered a solution that will direct more of these dollars to that front door. So if we identify a person that's trending toward homelessness, to help them and support them, again, in the community where they are living, rather than removing them, and really give them the whole team of support they need to get on a path to success. This was done before. When Governor Baker served in the Weldon Cellucci administration, that same policy existed when they took office. And within 2 years, Governor Baker, then Secretary of Administration and Finance, was able to help transition those individuals to a better place for support. that's what we'd like to accomplish now. Since taking office, the number has not increased. There are 10 communities that serve as hosts, and there are about 1,500 beds being utilized in this way. When we came into office, it's now down to about 1,300 too many. So we want to really, take control of this and work aggressively toward it, but we do need the tools through the budget to make sure that we can aggressively approach this and get better outcomes for these individuals and families.
So the numbers are going in the right direction.
They're going in the right direction, but we would like to move that ball a little faster.
Yeah, so speaking of the budget, I know that a temporary budget was passed. What is sort of the sticking points right now? Are we going to have a budget?
Well, it's not unusual to have a temporary budget put into place. A lot happens at the end of a fiscal year, and you're approaching the summer months, and the dynamic on Beacon Hill changes. So, I am optimistic, working with the Senate President, working with the Speaker of the House, our legislative colleagues in the House and Senate Ways and Means, that we will achieve a budget within the near future. If it's not right at the end of June, it should be somewhere in the July timeframe. That's why that 1 month temporary budget is put in place, so that there is a transition into the next fiscal year. And the Ways and Means, they'll have to sort out some of their differences. That's what conference committee is all about. It's a process. The governor and our team put our proposal out there. The Senate and the House have their ideas, but we need to come together and really move forward. I will say there was a lot of bipartisan support, again, around our communities, making sure we were funding, local aid and school aid, and now we just announced $5 million more for regional transportation. Those are good numbers for our communities. And we would like to see some more work done on the MBTA so that we get the tools to fix the T. And we'd also like to see the doubling of the earned income tax credit to put more money back into the working person's pocket. There are over 400,000 people that take advantage of the earned income tax credit because they're eligible for it. We'd like to double those numbers, and we'll see if that is a priority of the House and Senate as they come through the conference committee process.
And how about the early retirement program? I know that there were big hopes for that, but we didn't see exactly the numbers we were thinking right off the bat. So what is the plan for that? Maybe to expand it, or what are the talks for that?
Well, remember, when we started planning for the fiscal year 16 budget, we identified a $1.8 billion deficit. So our administration came up with a range of solutions, one of which was the early retirement program. And we estimated that through, we call it the ERIP, we could achieve about $180 million each year over a 3-year period of time in savings that we could build into the budget solve, so that we didn't raise taxes and could still maintain our commitment to cities and towns and protect essential services to the people that need help the most. And we were very pleased that our colleagues in the House and the Senate and the legislature, worked with us in a bipartisan way to support that early retirement program. So it's really a number around the savings instead of a head count. Like, how many people are retiring isn't necessarily what to focus on, but it's the savings that we can achieve through that program. And we feel confident that we're going to get really close to that savings so that we can avoid across-the-board layoffs.
Okay, and just speaking of money, of course, there was an audit on Mass Health recently that indicated that there was, misspending or not taking advantage of savings opportunities. What is your reaction to that report, and what is the response? How is the state going to respond to that?
Well, first of all, we discovered some deficiencies in certain areas of the state, and Mass Health is an area that needed attention, and as you could see from the report that the auditor released, we have a great new administrator there. His name is Jeff McHugh, who brings a really great depth of experience to administering the program. And reform is necessary, and we want to make sure that the Mass Health program is running effectively to make sure that the people that need help the most get their services, and that you weed out fraud and waste and abuse and inefficiencies in the system. And already Jeff McHugh has demonstrated great leadership in that area and is turning the system around.
Well, that is a program that will certainly take time.
And don't forget, Health and Human Services makes up over 50% of our $38 billion state budget. So, you can't be off when it comes to
Right.
managing the health and human services programs, because those are big dollars, big programs, and they have to be run efficiently to really help people that need the help.
And our health care is very important. And speaking of that, there was an announcement this week on handling the opioid crisis in our state. We're going to take a short break. We'll come back and talk about how we are handling this health crisis that is affecting communities across the board in our state. So stay with us. We'll continue our conversation with the Lieutenant Governor after this. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we're talking about some of Beacon Hill's top priorities. We talked about money, the state's finances, upcoming projects, and another big announcement last week was about handling the state's opioid crisis. After this, we're going to talk to someone from our area who is involved in meetings across the state to come up with some of those recommendations. But first, we are continuing our conversation now with Lieutenant Governor Karyn Polito. Thank you so much again for being here. I appreciate it. We do have a doctor on who, is able to really talk to us about what those waiting lists look like, because he's a doctor and he's seeing these people firsthand. It must have been something to hear the crisis happening across the state. I know that you've heard from people who are directly impacted by this. What is your response really to what's happening, how we're handling it now, and where we can go to make this better?
Oh, yes. Well, first of all, the governor and our team, obviously Dr. Rouse being a part of that, announced our recommendations. After touring around the Commonwealth, we had 4 public sessions, and really listening to how wide and deep this epidemic is. And the report said first and foremost we have to recognize that opiate addiction is a health issue. It's a disease, and that we need to make sure that people talk about it. So there's a lot more people talking about addiction, talking about opiates, and now this set of recommendations is all about tackling it. When we were campaigning everywhere in the state, there were no boundaries to this. No matter your economics, no matter what neighborhood you live in, no matter your age, so many people have become exposed to opiates, and not knowing their propensity for addiction, find themselves addicted, and then it's heroin, and then it's overdose, and then in too many instances, death. In fact, in 2014, we had over 1,000 deaths from opiate addiction. And I think it dates back, over the last 15 years, when pain became the 5th vital sign in the medical community, that it became far more available, opiates as a prescription. And people didn't really understand that, opiates are, an addictive drug. And over that period of time, it could have been a sport injury for a young person, or a work injury for a construction worker, or just removal of a wisdom tooth, and then that prescription to an opiate that has formed an addiction. And then that addiction has led to, a lot of tragedy in many individuals and families' lives. So we've taken this on very aggressively, working with the Attorney General, Maura Healey, and our team to make these recommendations. And the set of recommendations, there's a lot. There's 65, and I'm sure the doctor will get into those more deeply. But there's 4 basic areas. We need to do a whole lot more relative to prevention. Prevention, talking about it in schools, in our communities, and in our medical community. Prescribers, nurses, nurse practitioners, doctors, everyone have a much better sense with specific guidelines around opiates. And then, of course, intervention. That the PMP, the prescription monitoring program that doctors can use, make it far easier for them to just report it in 24 hours so that we know when the prescription was last, prescribed. And then, of course, intervention, the recovery and the treatment area as well. That we need more beds. When we discover that someone needs treatment, that it shouldn't be a monumental task for them to find a bed, or too many days pass for them to get a bed for treatment. We'll talk about that a little bit more, I'm sure, with Dr. Rouse. And then that there's no wrong door. If you are addicted and you need help, no matter how you come through the system, whether it's through the court system because it's criminally involved, we shouldn't treat that individual as a criminal. We should treat that person as sick and needing help. Or if it's through a community intervention, or just contacting state government. However you come to us, we will get you help. That's why we started with this public campaign. There's a lot of messages on TV or on the website. All these messages are starting to pop up when I'm doing my Google searches, which is really good and powerful. and just really, tackling this with all the energy and focus that our administration can bring to it, and with our law enforcement partners and our community partners, to really reduce the amount of addiction and reduce the amount of deaths from overdoses.
And also from the medical standpoint as well, you were saying there could be an athlete who gets hurt. I think we've all heard of people getting prescriptions for something and just getting way too many pills sometimes for what it appears to be that they may need, and then you're left with extras, that might sit in a cabinet. Is there any monitoring as to how much doctors are actually giving to these people who are hurt and, not looking for an extensive, pharmacy in their own bathroom? What would you say?
Yes, I think that prescription monitoring program, when fully implemented and used, will be a very helpful guide to all of those in the medical field to look at. And then, you have places like in Greenfield, where D.A. Sullivan and his team have worked with the hospitals there, and they have a physician's pledge about not over-prescribing opiates. That's a very powerful initiative that they have. And the governor is going to reach out to the deans of all the medical schools, and the Mass Hospital Association is engaged in the discussion around prescriptions of opiates. So that's all very good and can't be done soon enough. But then again, it's about the addiction, because sometimes an individual who has addicted will go to a friend or a family member and seek out somebody else's prescription to obtain the drug. Right. So there's a lot of layers to it, and that's why it's a complete community engagement, that everybody needs to be involved in the discussion, that you should not be ashamed if you are addicted or you have a friend or family member that is addicted. Talk about it, reach out, get the support, get the help, intervene. And then before that, I'm a mom, have 2 young kids. That prevention, that discussion in schools is very real and can be very impactful, but it needs to be consistent, needs to be across the Commonwealth in every community. So that's why we've asked for $5 million for an education and curriculum plan throughout the Commonwealth, and then over $20 million for more monies devoted to beds and recovery. That's what we're hearing, is the shortage of beds, and also, getting the family involved, like you said. That's another great point for that. And speaking of families, I know that you've been working in our area specifically on things like domestic violence. You've been in our area talking to women, empowering themselves in these situations. Talk to me. I know that you can't talk specifically where you've been, but can you just tell us sort of what your project is there? Yes, it's been a long time passion of mine. I'm a lawyer by training, and in my law school days I did a lot of work around victims advocacy and carried that passion through my legislative work. I was the lead sponsor of Jessica's Law to better protect kids from violent sex offenders, and now I find myself in a position as Lieutenant Governor to give more voice to strengthening and empowering women through both physical security and economic security. And if you know of an individual, particularly women and men, that find themselves in a cycle of violence, there are places you can go to get help to break out of that cycle and achieve physical security first and foremost, and then to be able to empower that individual with not only safety but skills and child support and wellness support to the extent they need that to get on a path to success. I've heard a lot of stories about many women who are mothers who have remained in that cycle of violence. It's been very hard, and then it sets up the next generation for having been exposed to violence in their lives. So it's very important to try to break that cycle, and I'm working with the Advisory Council. We've assembled a great group with leadership here from Western Massachusetts that's helping us, and I'm traveling around the state and really finding what's working relative to the shelter program, relative to housing, relative to economic empowerment for women. And the governor always reminds us, when you find something that's working, just do a whole lot more of that. So I'm really discovering the things that are working well in that area and just trying to do a whole lot more of that. Nice to hear that conversation is even being had. Sometimes just hearing it might empower women to say, like, oh, you know what, that's me, and there is something available, and have them feel comfortable to reach out. Lieutenant Governor Karyn Polito, thank you so much for being here and talking to us. We covered an array of issues. There's a lot to talk about, and I know that you have a lot more to do, so I'm looking forward to seeing where we go from here. So thank you so much for being on. I appreciate it. Thank you, Laura. And when we return, we'll talk to a doctor on the governor's task force about the opioid crisis. Stay with us. You're watching 22 News in Focus.
Welcome back to 22 News in Focus. Today we're talking about some of the top issues impacting our state right now. We just spent the last half hour talking to Lieutenant Governor Karyn Polito. When we left off, we were talking about battling the state's opioid crisis. This is something affecting a number of families in our area, which is why a doctor in our area wanted to get involved. Joining us now, we have Dr. Robert Roos, the Chief Medical Officer of Addiction Services at the Sisters of Providence Health System. Thank you so much for being here.
Thank you very much, Laura. It's a pleasure.
I know that this is something that you know a lot about. You've really immersed yourself in this. Talk to me about what our situation looks like in Western Massachusetts. I know that there's a number of beds and then there's a number of people needing beds, and sometimes those numbers don't quite add up. So talk to me about that.
Sure, and I will say that when this epidemic is described as a crisis, this is very appropriate terminology. I mean, we are truly grappling in Western Massachusetts as well as in the entire Commonwealth with a major public health problem. As I see it, opiate addiction is the leading issue that we need to address from a public health standpoint. It's the #1 cause of injury death in the Commonwealth as well as in the entire United States. And when we look at substance use overall, including alcohol, nicotine, and other drugs, it's the single greatest cause of preventable death in this country. So when we look at this issue, there's this larger picture of, you know, the use of substances is something that affects nearly everyone or every family in this country, and particularly in our region. As we started to learn more about how opiate addiction affects individuals and families in Western Massachusetts, we have realized over time that this is affecting all demographics. Every single community, whether it's inner city or rural, is impacted by this. The rates of opioid overdose death have increased dramatically over the last several decades, so now that it is far surpassing motor vehicle accidents, and nearly 3 individuals die of an unintentional opioid overdose in the Commonwealth every single day.
Is there any one reason why the numbers have gone up, speaking of that?
Well, there are many reasons. There's multiple factors. Part of that was the initial increase in opioid use and prescriptions that had escalated throughout the 90s into the 2000s. That increase in use of prescription painkillers made opiates more available. And then we know that that then followed with more individuals being exposed to, misusing, and developing addictions to them. When that addiction starts to set in, then other complications, including the fatal tragic overdose death, can happen. And most recently, we've seen the increase in heroin overdose deaths so dramatically as the availability of prescription painkillers has been reduced, and because of the availability and accessibility of heroin, relatively speaking, in the communities here. Heroin can then cause an additional risk for overdose death.
And so what do the numbers look like here? You know, I know that we hear that there are just not enough beds. What does that crisis actually look like?
Yeah, when people are talking about beds, you know, generally referring to inpatient detoxification beds, but there's also a number of different areas of the substance abuse treatment system that contain inpatient treatment that we would also call beds. So there is a inpatient detox beds, then there are stabilization beds, which can be a step down from detox, and then there are longer term treatment program beds that patients can receive treatment for months or even years at a time. Right now, there are 60 beds for inpatient detox in Hampden County, which generally services the most of Western Massachusetts, because there are no inpatient detoxification beds in Hampshire or Franklin County currently. What that often leads to is when patients are looking for urgent assistance and help, they're looking to try to get into what is a relatively limited number of beds to seek that treatment, and are often found waiting for some period of time.
And how long is some period of time? Are they waiting days, hours, weeks? What can that be?
It really could vary. I mean, it could be hours to days, generally not weeks, but sometimes as patients are looking to move through the system and they're looking for outpatient treatment, particularly treatment for opiate addiction that involves medication. Because when we look at the evidence for what is the most effective form of longer-term treatment for opiate addiction, the treatments that have the most success in reducing illicit drug use, but also reducing death and other comorbid or other dangerous effects, we're looking at medication combined with therapy. That's methadone or buprenorphine or naltrexone combined with other education and counseling that can be continued over time. And sometimes those programs, we've seen the largest waiting lists or the most difficulty with access to treatment in this area.
And this must be one of the worst places to have a waiting list, because I can't imagine how difficult it must be to finally say to yourself, I'm ready to get help. I'm in a bad place and I need to admit that to myself. You know, because sometimes you can't get there. So when somebody does get there, they're ready, they pick up the phone, and then they have to wait. I mean, do you find that people will then change their mind or drop off or, you know, not take it when it becomes available because now they've changed their mind?
It can happen. When we're dealing with addiction, you're dealing with a disease that has a lot of ambivalence associated with it, because there's a great compulsion to continue to use because of the way that the brain has changed over time. However, that great motivation to stop using and to enter recovery can be just as powerful. We want to be able to, as a society and as a treatment community, meet people where they're at, provide the level of treatment that they need at the time in which they need it, in the place in which they need it. And if we can do that, then we can have enormous success in combating the problems.
And I know that there are more detox beds than there are like the second level and third level, kind of keeping that long term. So do you find that people come off the detox beds, there might not be a long-term bed available, and then they're back in society and the recidivism happens? I mean, do you see that?
Absolutely. I mean, I think as part of the report from the governor's opioid working group, we did realize that there are many individuals who continue to use detox services over and over and over again. And what that tells me as a treatment provider, as well as somebody looking at the data, is that number one, a very short course of treatment in a detox facility is not an appropriate course of treatment for what we know to be a chronic disease over time. What it also tells me is that there may not be enough connections to aftercare and community resources to treat this illness. And so the better that we can design a system to allow people to continue their treatment over a longer term and have easier access into different points of care that isn't just detox, the more hope that we can give individuals, the more treatment that we can provide, and then ultimately the more beds that will become available.
Okay, well, I know that there's been a lot of time spent on trying to figure out exactly what recommendations need to be made and then implementing those in the state. So I want to take a short break and then come back and tackle some of these. There are a lot of them, so we probably won't get to all of them, but we can at least cover the big ones. So we'll talk about those recommendations that came out this week after the break. Stay with us. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we've been talking about some of the top issues facing our state. We are continuing our conversation now with Dr. Robert Roos, the Chief Medical Officer of Addiction Services at the Sisters of Providence Health System. Thank you so much again for being here. You were a part of this group, this traveling group around the state to hold these meetings and find out how to tackle the opioid crisis. What were some of the things you were hearing? And let's talk about these recommendations that were made this week.
Absolutely. This was a really compelling, engaging, collaborative process that we went and entered into as a working group. And I will say that as a working group, which was an 18-member working group chaired by Secretary Mary Lou Sutters of Health and Human Services, we had 11 in-person meetings. We went around the state to 4 different locations, including Greenfield here in Western Mass and Worcester in Central Massachusetts. We heard from more than 150 organizations with testimony. We heard from more than 1,100 individuals that spoke to how this issue has impacted them. And so this was an enormous amount of data gathering and listening and understanding this issue, because as we all know, this is a very complex issue, and complex issues are going to require complex solutions that can evolve over time and look to touch a wide variety of areas.
So let's talk about these recommendations.
And I will say that what Lieutenant Governor said, the defining feature of these recommendations, and I think the Commonwealth has been working on this for many, many years. In fact, there's 30 years of history of working to tackle opiate addiction in the Commonwealth, is that the defining feature of these recommendations really are addressing opiate use, addiction, and overdose as a health issue. We must understand that at every level, this is something that, while it may have criminal aspects at certain junctures, is truly a public health condition and will respond to public health solutions. And so those recommendations took that framework. Our recommendations took that framework to really apply a model for how we can address this best. And that framework involves primary prevention. There's one truth about addiction. If you never try a substance, you can't become addicted. If you try it, there may be some possibility that you could develop a problem with it. So we want to do as much as we can as a Commonwealth, as a community, to prevent individuals from ever having an exposure to an opiate unless it's appropriate. And so that piece of prevention is so critical, so important. Some of the recommendations that have touched on that have already begun to become in play. One of them is a public awareness campaign to raise awareness about the appropriate use of opiates, the harms and dangers and risks to using opiates, as well as the importance of safekeeping, safeguarding, and properly disposing of leftover medication. That alone can reduce the amount of medication or opiates that somebody might get exposed to. Along with that education piece is also educating medical providers. Massachusetts has been a leader over the last 5 years in requiring physicians to obtain 3 hours of continuing education in how to treat pain and appropriately prescribe opiates, and we've seen some impact from that. But these recommendations look to expand that, not only to physicians, but to all licensed medical providers, including dentists and other providers, as well as incorporate and mandate training to occur in the identification of problems and the treatment of addiction. Because that is so important when we look at how we address this condition, to make sure that we appreciate that some people will develop problems, and then how, as providers, we can address that. So that's really important when we look at how do we prevent this in the first place from ever happening. Because ultimately, we want to be not talking about this 50 or 50 years from now, or a generation from now. When we look at when patients do start to identify problems, we look at how we can best intervene. Interventions are so critical to reducing the development of problems as well as overdose deaths. One of the ways that we can do that is improve the prescription monitoring program, which has been talked about previously, and this is a statewide electronic database that logs all controlled substance medications that are filled in a pharmacy, with very few exceptions. This database is mandated for providers to be enrolled in and to use before prescribing a controlled substance to a patient. And so it's now the responsibility, as we improve the functionality of the prescription monitoring program, to also enforce the mandatory nature of the requirement that all providers are using it. This will go a long way in having providers understand and recognize when their patients may be using other medications that can be risky in combination with what they're considering to prescribe. In addition to that, the key element of intervention that these recommendations are very strong in is the utilization of data. It's been very difficult over time to respond to the needs of a community when we haven't had great access to data. And the Department of Health and Health and Human Services did a very bold action several months ago and released data to the public around overdose death as well as prescription monitoring program data. And I want to commend the Commonwealth for that and really use that as an example for when we have information, we can quickly deploy resources and target interventions to communities like Western Massachusetts, who are going to have unique needs compared to other places in the Commonwealth. And that is a key point of this recommendation as well. When we look at treatment, ultimately the individuals who develop an addiction or develop a use disorder related to opiates, they need treatment. And we want to be able to provide the level of care that they need at the time in which they need it, at the place in which they need it. And while that may be beds for some patients, that may not be, and may be outpatient treatment for others. And so these recommendations do many things to enhance and expand the ability for treatment. One of those things is first to understand where treatment is available and what type of treatment is available. Creating a statewide database with real-time access to where the beds are, what's available, and where the other resources are for treatment with a single point of contact will go a long way in making use of these resources more efficient. In addition to that, expanding the number of beds in the programs that are post the detox programs to allow less people needing to leave and allowing more people to engage in treatment over longer periods of time. And expanding that very important medication-assisted treatment that I mentioned before. Expanding the ability for programs who are using medication and therapy in combination to allow to treat more patients and continue that treatment for longer periods of time. Those are very important interventions in regards to how we provide treatment to individuals. And then lastly, the fourth category is recovery support. Looking at how we support individuals achieving recovery. And when we look at recovery, recovery is a process of change. It's not a one moment miraculous intervention. It's a process of change in which individuals are working towards health, wellness, and an improved sense of self and well-being. And that is something that needs support over time. And there are multiple ways in which that can happen. One is which integrating mental health and substance use services more directly to remove those barriers that may be present now to have patients be able to continue treatment longer. To work with recovery coaches or peers in the field to be deployed in areas like emergency departments where there might be needs, to connect with people to help them get into treatment when they feel like they're struggling. And work to create a real system of care that appreciates that addiction is a chronic disease, and stigma can negatively impact the individuals and prevent people from getting into treatment. And so these recommendations, at its whole and also through its components, very strongly state that this is something we need to treat as a health condition, that treatment can work and is very effective, and that people recover if we provide them with the appropriate supports. And we want to encourage people seeking help, not being shamed or afraid of doing so.
Some of these sound like they can be implemented right away. We're already seeing the campaign on the airwaves right now talking about this. What do you think is the timeline for some of these recommendations? What can be done quickly and what do you think will take longer? And of course, this is out of your hands. These are recommendations. It's up to them to do this. But what in your experience do you think is something that can happen quickly?
Sure, and there are a couple things that are already in motion. And so I will give great credit to the Secretary of Health and Human Services and the Commissioner of the Department of Public Health for moving forward on things very quickly. It is out of our hands to an extent. This is the hard work of implementation that has to happen now, and we can take these recommendations forward over the course of the next months to years. But there are several things. One is there is an immediate change in the reimbursement rates for recovery homes that is going to be effective as of July 1st. That was made so that more places can support the treatment that they provide. Another one is that there is a process in Massachusetts which is unique to Massachusetts and not to every state, called Section 35, which is a process in which family members or professionals can petition the court to have somebody involuntarily civilly committed to treatment. And the history here is that there has been certain times in which that treatment has ended up leaving that individual going to one of our correctional institutions as opposed to a treatment facility. And it's a high priority and something that is in motion already to transfer the beds that currently exist in the correctional institutions all towards the mental health facilities under the jurisdiction of the Executive Office of Health and Human Services, which represents an enormous demonstration of commitment to show that this is something that needs treatment, not punishment. In addition to that, I will mention the public awareness campaign, which has already been launched, called Stop Addiction. You can find it through the Department of Health website, and it's airing public service announcements and has resources available online. And
how about the location of beds? Was there the recommendation to put them in Hampshire and Franklin? It's interesting that they're only in Hampshire right now.
Sure. So right now the detox beds are in Hampden County, and there are beds that are going to be available in Franklin County later in 2015. Actually, there will be 64 beds that will become available, 32 for that acute treatment services and 32 for that step-down clinical stabilization service that will be provided in Franklin County, which will help a lot of patients find treatment in the community in which they live.
While some of these recommendations won't be able to be implemented right away, it is nice to see that there are some changes happening right now and that those beds are very critical. We hear that a lot from the community. That is very, very important to us here. Dr. Robert Roos, thank you so much for coming on and talking to us about this. You've been doing a lot of work, and there's lengthy recommendation lists, and it's just nice to see. I'm sure a lot of families are happy to see so much attention given to this issue. Thank you so much. And we will have the last word for you after the break. Stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we talked to Lieutenant Governor Karyn Polito about some of the biggest issues facing our state right now. We talked about the budget, money-saving measures as well. We also talked about health issues, including the opioid crisis with a local doctor who's been working to create change statewide. We hope you heard something today that you may find helpful if you know someone who is suffering from addiction. That is our program for today. We want to thank all of our guests for joining us. Thanks to you at home for watching. If you've missed any of it, it's on our website, wwop.com. Have a great day.